So I want to talk to you about something that is relatively rare, but apparently not so rare here in Fairbanks, because in the short few months that I've been here, I think I've seen more testicular torsion cases than I've seen in the equivalent number of years anywhere else. And I don't know why that is, but that seems to be the case. So what is testicular torsion? Well, testicular torsion is when the testicles, they're hanging into the scrotum, and the scrotum is like a bag, and it's it's hanging with, because it's at the end of the spermatic cord, and the testicles actually start in the back of the body, believe it or not, where the same as the ovaries, and the ovaries start making their way down, and they stop. Well, the testicles, they go all the way down, they come through the inguinal canal and all the way down to the scrotum, because spermatogenesis happens to be that much better when there's a little bit more fresh air, because the temperature has to be lower. If it's too high, that's not good for making sperm, which is why if you're having a hard time with your sperm count, then they'll say, well, have you been taking too many sauna baths? Have you been hanging out too much at China hot springs? If you go into the hot springs too many times this year, maybe your sperm count is going to be lower. So going back to testicular torsion, well, like I was explaining, that the testicles are hanging with the spermatic cord, and they're hanging at the end of this cord. Well, they can twist around it, and if they start making little twirly loops around the cord, eventually what will happen is that the blood supply to the testicle, which is coming through the spermatic cord, that gets pinched, and it actually gets completely blocked, and without blood the testicle will die. And I had a young man actually that came to the emergency room, and he had a testicular pain that was on one side, and he just thought he would tough it out, but he toughed it out for too long. 3-4 days later, unfortunately, it was too late to salvage that testicle, and he lost his testicle. So if you have sudden testicular pain on one side, please don't tough it out. Come to the emergency room, get checked out. And when you come in, what they'll do is they'll do an ultrasound on your testicle, and they'll see if there's blood flow or not. And if there is no blood flow, it's considered a medical emergency. We have 4 hours to operate and to untwist it in order to make sure that it survives. One of the things that we do, regardless of what happens on that one side, we do a procedure called orchidopexy on the left side, which is fixing the other testicle in place with small little sutures, so that way the other testicle doesn't do the same thing, because we don't, especially if someone loses their testicle on one side, we don't want the other side to start doing the same type of tricks and to start twisting and turning and pinching the blood supply. So that's the story behind testicular torsion.